Good afternoon, everyone. I am Tom Madero, Chief Human Resources Officer for the Touro University System, which of course includes my favorite division of New York Medical College. I'm always very pleased to visit the NYMC campus, especially for an event such as this one. More so, I'm especially pleased to be able to announce that not only has the Director of Human Resources search concluded, the new director has already begun the assignment and is in attendance at the meeting today. Avi Dennis has been a key member of my HR leadership team, most recently as the Director of Human Resources Information Systems. Overall, Avi brings 10 years of human resources experience to the position, and he has played a significant leadership role collaborating with staff and faculty across the Touro system. He has also recently completed his studies for a law degree, but we won't hold that against him. Avi has been involved in many New York Medical College projects and has a unique perspective that will allow for additional innovation and improvement in HR operations. I genuinely believe his passion for improvement, partnership approach, and dedication to NYMC success will add great value to the college. Avi's office is in the HR suite, which is located in the Skyline building, and he will report to both me and to Dr. Halperin. More fun for you, Avi. Please allow me the great honor to introduce you to Mr. Avi Dennis, who is seated here in the third row. Don't know if he's on the Zoom, but that's him. Thank you very much. Everyone have a very good meeting.
Next, we'll hear from Ben Johnson, please.
Hello, everyone. I'm pleased to tell you that we have been successful in hiring 2 faculty members in physical therapy. Unfortunately, we were not successful in making a hire, though a letter of offer was extended to another candidate, but the position remains open. If you happen to know a licensed physical therapist who has 6 years of higher education experience, 3 years as a core faculty member who has an academic doctorate and experience in doing CAPT, please refer them to me. Insofar as CAPT accreditation for physical therapy, I'm pleased to report that the situation we had earlier has been removed. We are no longer in a probationary status, and unfortunately that happened with bad timing insofar as our enrollments are concerned, but I'm very pleased that Michelle and her team have managed to pull a rabbit out of a hat, and we hope that that will continue to stick. So we have no citations against us, and hopefully we'll move forward in a very positive situation. So any questions, I'm happy to answer. Speech and language pathology is doing great, and public health is doing great as well. Thank you.
Thank you, Ben. And we'll hear from Neil Schluler next, please.
Hi, good afternoon, everybody. Dr. Halpern asked me to give an update on several recent chair searches. I think most of this information is known to you, but we've had, I think, a very good run of recruitment for chair positions here at the school in conjunction with our partner at Westchester Medical Center. Today is the first day of the appointment of Dr. Sean Desai as the chairman of the Department of Otorhinolaryngology, both at the medical school and at Westchester Medical Center. Dr. Desai comes to us from Johns Hopkins University School of Medicine, where he was an assistant professor in ENT. His particular field is in facial plastic and reconstructive surgery. He's very well known in that field. I think he's going to be a great addition to our campus. In addition to a good academic record, he's received numerous teaching awards wherever he's been, and seems very enthusiastic about joining our faculty. He's actually a Poughkeepsie native. His parents still live there. So in a sense, this is a homecoming for him. And as I mentioned, he begins today in that role. And I want to extend my gratitude to Dr. Sharad Gandhi, who chaired the ENT search process. It took a long time, but I think we wound up with a terrific candidate. The chairman of surgery, search ended recently with the announcement of the appointment of Dr. Kartik Prabhakaran as the incoming chairman of the Department of Surgery here at New York Medical College and also at Westchester Medical Center. Dr. Prabhakaran has been here, I believe, for 11 years and currently leads the trauma surgery division at WMC. He has grown the trauma surgery program under his leadership to be, I think, really one of the outstanding, if not the outstanding trauma programs in the New York metropolitan area. It's certainly the largest program in the Hudson River Valley and has wide reach throughout this region. And has been a purveyor, I think, of outstanding care and also very significant academic activity. That was a national search. That committee was chaired by Dr. Peter Panzica, the chairman of the Department of Anesthesiology. There were a number of very strong candidates, and we're very happy to have Dr. Prabhakaran take that role. He will officially begin in that role on July the 1st. Dr. Prabhakaran has been a very good citizen of the medical school, has provided lots of mentoring, teaching, and opportunities in research for our students. And I think his appointment is very good news here and will continue a very good relationship that we've had with the Department of Surgery over the last several years. Finally, there's a search underway for new chairman of the Department of Radiology. Dr. Tzvi Lefkowitz has announced his retirement from that position effective June 30th of this year. So again, there's a national search underway for the position of chairman of the Department of Radiology at NYMC and chairman at WMC. That search is led by Dr. Halpern, and candidates are being reviewed for the first round of interviews for that search. And we look forward to a successful search. It's an interesting time to be searching for a chairman of radiology. Radiology seems to be one of the fields where there's been a great deal of speculation, let's say, about the role of artificial intelligence in the future of radiology. So it will be interesting to see the candidates come through and how they think about that. All of these three searches, as I said, were done in very close cooperation with Westchester Medical Center. And I'll just say, although I was asked just to talk about these chair searches, but in that context, I'll say that I think that over the past year, our relationship with WMC has deepened in many, many ways, and I think in many, many good ways. And I think we have, in a sense, a revitalized relationship with WMC now that will benefit us greatly. A small but not insignificant manifestation of this, if you drive past the hospital now, there are new banners at the hospital that say Westchester Medical Center and New York Medical College. And I think that's the first time that has ever happened. The medical center seems to be very committed to the relationship with the school, and I think that bodes well for us. So those are my updates. Questions later? We'll take questions later. Thanks.
Thank you. Thank you, Neil. We'll hear next from Greg Allman, please.
Good afternoon. I'm Dr. Gregory Allman, Vice Chancellor for External Academic Affairs. My role is to work with the college and follow leads and identify and procure additional affiliations, which will broaden our students' exposure clinically. I was asked to report on our three newest affiliations that have students currently. I'll start with Yuma, which was the first one I took on as in my new role. Unfortunately, that relationship is ending because they've decided to partner with an institution within the state of Arizona, to my understanding. Next is Hudson Regional Health. That's a rapidly growing healthcare network in Hudson County, New Jersey, that operates hospitals in Secaucus, Bayonne, and Hoboken. New York Medical College has become the sponsoring institution for the residency programs, which Dr. Valentin will speak of in her section coming up. As far as students, we have 24 students signed up for family medicine at Hoboken for next academic year. And then finally is Mount Sinai at Miami Beach. This is a newer affiliate that we are grooming to hopefully become a regional branch campus of New York Medical College. Currently, for the 2026 to 27 academic year, there will be approximately 67 students registered to take one or more rotations and/or electives at Mount Sinai, to include clerkships or rotations in internal medicine, OBGYN, surgery, psychiatry, in addition to some electives for the third and fourth year students in emergency medicine, anesthesiology, and urology. In addition, we have students from the other schools that are also doing some of their clinicals there. Thank you.
Thank you, Greg. We've got two folks who are going to give us their reports by recorded messages, Ronnie Myers and Pam Ludmer.
Good afternoon. I'm Dr. Ronnie Myers, Dean of the Toro College of Medicine, and I'd like to tell you a little bit about our New Mexico initiative and where we are in that process. The little history here is that in March 2023, we got a approval from our accreditor to increase our enrollment by 100 students. And in July of 23, our first increased enrollment in the class of 2027 made their entry into the dental school. And in September 24, we had our groundbreaking in New Mexico, where our students were going to be. In June of 25, we opened the New Mexico program in New Mexico, and the class of 27 moved in. This increase was with the first 2 years being in New York and the last 2 years being in New Mexico. And in March 26, just last couple of weeks ago, we had our final site visit in which we had no recommendations, and we look forward to continuing our educational journey in New Mexico. So why New Mexico, the land of enchantment? It is a beautiful place. The weather is great, but if you look at the external assessment, why did we go to New Mexico to build a clinical facility? It's because they are a state completely in need. In fact, if you look at the graph of the United States on the left-hand side of the screen, the number of individuals that are covered by Medicaid in New Mexico is the greatest in the country. And so that bar graph, all the way to the right of that bar graph, is New Mexico. So it is a population in need, underserved, underinsured, and in need of dental care. There's no dental school in New Mexico. And so therefore, going to New Mexico, we could attract New Mexican residents to actually hopefully go to dental school. The dentist in New Mexico, the ratio of dentists to population is actually decreasing. If you look at the graph on the upper right, you'll see that the dentist in New Mexico per 100,000 population is actually gone down since 2017 every year. You'll also see that the median number of dentists in New Mexico is significantly below the national average, meaning that people have to drive much further in New Mexico than they do in other places to get to a dentist. And in New Mexico, there's some rural counties that have ratios exceeding 1 to 10,000, and at least 3 of the counties have 0 practicing dentists. Now, one of the reasons that we went to New Mexico also to increase the number of individuals in New Mexico who might consider oral health care as a profession. And we've done an incredible job. In 2020, we had 0 applicants from the state of New Mexico. And this year we've had 17 applicants from the state of New Mexico. And in fact, 3 of them have actually been offered admissions and have given us a second deposit. And there's lots of evidence that says where you train is where you'll wind up. So our outcome that we're looking for is to actually train New Mexicans, actually to stay in New Mexico, and to increase the number of dentists there. New Mexico is an opportunity, as you know or may not know. The New York Medical College has joined into an agreement with Lovelace Biomedical Research Labs in Albuquerque, and in their space, we were fortunate to have the area that we could build our dental clinic and therefore open the dental school there. And it also makes to the mission statement of both the university and the Toro College of Dental Medicine. The core value of the university is based on 2 fundamental components, as reflected in Hillel's dictum. If I am not for myself, who will be for me? And if I'm concerned only with myself, what am I? And since the mission of the Toro College of Dental Medicine is to bring excellent healthcare services with integrity, compassion, and empathy to the population, bringing that to New Mexico was something we wanted to do. And lastly, if we were to look at the transformation of the space in the Lovelace building, you can see here on the left what the atrium looked like before our renovation, and on the right what it looked like after our renovation. And if you look at what we did, we actually took out the entire inside space, put down the plumbing and the piping for the dental units, and we wound up with an incredible facility to bring oral health care to those in need in New Mexico. That's where we are today. Our students are busy seeing patients there. We see about 70 patients a day now, and increasing all the time. I'm happy to have presented this update on where we are in Albuquerque, New Mexico with our increased enrollment, and I appreciate the time. Thank you.
Good afternoon, everyone. I'm Pamela Ludmer. I'm the Dean of Undergraduate Medical Education and Faculty Accreditation Lead for the LCME. I'm here today to give you an update on our LCME accreditation status. As many of you know, in 2024, the School of Medicine was granted a full 8-year accreditation term by the LCME. This is a testament to the hard work of all of the School of Medicine and many members of New York Medical College community. And I'd like to thank you for all of that work that you did to help prepare us for that visit. As part of the 8-year cycle, the LCME, as they do with most schools, did find a number of elements that require monitoring and a status report update to the LCME due in August of 2026. This wasn't a surprise, and we were eager to begin work to address these elements as part of our continuous quality improvement and data-driven decision-making efforts. To address these elements, the EQUIP team, that's the Education Quality and Improvement Program, convened 14 dedicated working groups. Since January of 2025, these working groups, comprised of stakeholders from across the School of Medicine and New York Medical College, have been hard at work. They've been reviewing the LCME requests, analyzing data, initiating new action plans, and most importantly, assessing the impact of those action plans to make sure we're getting positive results. And I'm pleased to say we've seen many positive impacts as a result of this work. We're now in the final steps of reviewing the most recent evaluation data and are working on drafts for the written responses that we will submit to the LCME in August of 2026. I'd like to thank all the faculty, administrators, and the students who have participated in this work for taking the time to respond to all of our requests for feedback and for the work you've done in terms of action planning. Your engagement is a reflection of your commitment to ensuring the School of Medicine is the best that it can be. I look forward to continuing to share updates on our progress with you. Thank you.
We'll hear next from Lashari Valentin, please.
Hi, good afternoon, everyone. I'm Dr. Lashari Valentin, the Associate Vice Chancellor for External Academic Relations and also the designated institutional official here at New York Medical College overseeing graduate medical education. So New York Medical College we sponsor about 39 programs, really 36 ACGME programs, 2 dental programs, and a podiatry program. These programs are located within 4 states, so New York, New Jersey, Pennsylvania, and Rhode Island. And we have over 800 trainees within all of the programs. All of our trainees are within the 9 institutions. We have Metropolitan, St. Joseph's Medical Center in Yonkers, Hudson Regional Health, Westchester Medical Center, St. Mary's St. Clair's in New Jersey, Lower Bucks Hospital in Pennsylvania, Landmark Medical Center in Rhode Island, Roxborough Memorial Hospital in Pennsylvania, and St. Michael's Medical Center in New Jersey. Here's a listing of all of our programs and where they're located. Both of our dental programs are within the New York Medical College umbrella. We have an ophthalmology program at Westchester Medical Center. Metropolitan has anesthesia, dermatology, EM, internal medicine, endocrinology, diabetes and metabolism, GI, nephrology, pediatrics, PM&R, psychiatry and surgery. St. Michael's, we have our cardiology, our GI program, our HEMONC, infectious disease, internal medicine, and pulm critical care. Our St. Mary St. Clair's, we have anesthesiology, IM, OBGYN, podiatry, psychiatry. Hudson Regional has 2 family medicine programs, a GI program, IM, surgery, and a transitional year program. Lower Bucks has cardiology, family medicine, internal medicine. Roxbury Memorial, family medicine and internal medicine. St. Joseph's, family medicine and psychiatry. And Landmark in Rhode Island has internal medicine. So within our, so as New York Medical College sponsors all of these programs, we do have our sponsoring institution accreditation visit scheduled for next July of 2027. We didn't receive the official notification yet, but they're usually between 10 and 15 years apart, and so we're due. All of our programs currently, all 39 of them currently are maintaining initial or continued accreditation, with the exception of one program that is currently on warning, but is progressing as planned towards full accreditation status. Just some updates regarding what our GME office kind of manages. So we oversee all of the accreditation for all of our programs. So we really look at compliance very closely. We monitor policies and systems, institutional readiness. We review data all the time, reporting, and certainly the GME platforms such as New Innovations, where our trainees document duty hours, et cetera. We also host a variety of programming. We have our program directors boot camp, our associate program directors boot camps, residency coordinator boot camps. We do have our upcoming New York Medical College residency fair, where all of our sponsored programs will be here on our campus. We do offer a lot of program support, whether that is assisting with remediation plans or helping to craft individualized learning plans. We do have our faculty development office that is heavily involved in supporting our programs. We also offer research support on our campus. And also we're very involved in the wellness of our programs, our trainees. We work very closely with each of the program directors to ensure that it aligns. Our programs are overseen by our GMEC committee in addition to our GME office. And we're closely looking at program evaluations and monitoring program improvement plans, et cetera. Strategy and growth. So we have new programs on the horizon. We do have a new program application that was recently submitted for Hudson Regional Health, which is an orthopedic surgery program. We're still waiting for the official notification of approval. And also all of our current GME programs, many of them are working on expansion. So that would be like a complement increase to increase the trainees within the program. We do have plenty of institutional partnerships, as we have lots of PLAs or program letters of improvement, which is, program letters of agreements, which are agreements in place with other institutions so that our residents can rotate at other facilities that we don't have partnerships with. So what's ahead? We currently have our Rising Chief Resident / Rising Fellowship boot camp coming up, Chief Fellow boot camp coming up on May 8th. This will be in collaboration with the residents, Rising Chief Residents and Rising Chief Fellows located at Westchester Medical Center. The program will be located in our Skyline Dining Room. So it will be on our campus for a full day on May 8th from 8 to 4:30. We have a lot of guest speakers, so we're looking forward to this programming. It is our very first one for this, so we look forward to that. We also have on May 12th will be the New York Medical College sponsored programs residency fair. We have also included the WMC programs. So this will happen in the BSB cafeteria. That will be from 5 to 6:30. We look forward to that. And then other things, just our graduations and our orientations will take place in June and July. And this is how you can reach us if you ever have any questions or concerns or just want more information about the GME office. Thank you.
Most of you know me, and my name is Dana Mordew. I'm a faculty member in the Department of PMI and Vice Chancellor for Accreditation and Student Support. Today, I'm going to actually talk about Middle States accreditation. Some of you may know what it is, some of you may not. Middle States is the regional accreditor for New York Medical College. What that means is it accredits the entire college and university. So unlike LCME, which is a program-specific accreditation and a number of other program-specific accreditations that we have, Middle States is what we need to actually accredit the entire college and university, our entire college. So why is that important? If we don't have Middle States accreditation, we can't get federal student loans. So it's very important. It is also a college-wide effort. Now, if you remember back probably 2019 to 2021, most of us remember the pandemic and everything that was going on, trying to make sure we delivered the best possible education for our students as well as the patients that some of them met with. In addition to that, we were undergoing our Middle States self-study for reaccreditation. And it was a tough time for many people. Many people from across the college worked on this, but phenomenally, we got 8 years of reaccreditation with absolutely no recommendations, no reporting, nothing. So we did phenomenally well with that. We actually got commendations as well that I want to actually highlight once again. They loved our strategic planning process. They loved the fact that it was inclusive. They loved the fact of how we assessed our strategic plan, and they actually liked the self-study document of 100 pages that we put together along with the evidence inventory that we needed to host the visit. The bad news is the 8 years of accreditation is winding down. And so today I will launch that, I will announce that we are launching the New York Medical College Middle States self-study effort for the accreditation visit that we will have in the spring of 2029. We actually have already launched it in essence in terms of some of us are undergoing some training for that. And because of the training that we just had this morning, I can now announce a little bit of a timeline for everybody. So over the summer, we're going to actually be looking and forming a steering committee for the Middle States self-study. The self-study is actually, the accreditation, first of all, it requires a self-study to show how we are meeting the accreditation standards that Middle States has in the context of our mission and vision. Then we will host a Middle States team visit to review our self-study in the spring of 2029, meet with all of us over a 3-day process, and provide a recommendation to Middle States, who will make the ultimate decision at the end of it. So the timeline, like I said, is we're going to be forming the steering committee this summer. We have to, we will be working on what's called a self-study design draft, which is about a 15 to 20 page document that says how we are going to do the self-study, who is going to be actually on the steering committee, who is going to be chairing the individual subcommittees for each of the standards, and what we hope to gain from the process, kind of a roadmap for it. So that has to be done by the end of the summer in early September. And in the fall, we will host a visit from a new vice president from Middle States who has responsibility for our school, who will come here for a day or two and help us discuss the self-study design that we have put together, any questions that we have on how we want to proceed, and to make any corrections that he wants us to make for the self-study design. And at that point, we will launch approximately a 2-year college-wide, inclusive, transparent self-study to show how we actually are meeting the accreditation standards for Middle States. And like I said, we will be hosting that visit in spring of 2029. Middle States accreditation and all accreditations is a college-wide effort to some extent, depending on the program of the college. And they're all interrelated very closely together. So whenever we have something that goes wrong with a Middle States visit, they contact our other program-specific accreditors. And whenever there's something that is noted in a program-specific accreditation, Middle States gets notified. And so I want to emphasize this is going to be a college-wide effort. We need your participation. We need everybody who is involved to help out with the process. And if you want to actually participate, please feel free in terms of contacting me, and we'll see where you can we can plug you in. But it will be a college-wide effort, and I'm sure many of you will be hearing from myself or the co-chair. So thank you very much.
Thank you, Dana. There were a few points made during the presentations I'd like to highlight. Neil Schluger pointed out the creation of the banners surrounding Westchester Medical Center with now our name on it with the hospital. I had 4 dreams 14 years ago when I got here. One was that there was going to be a big sign on the top of the hospital that you could see from the parkway. 2, that there were going to be banners around WMC. 3rd, that there was going to be a big sign on Metropolitan that you could see from the FDR Drive. And then when they opened the 2nd Avenue subway, that there'd be another sign on Metropolitan that you could see when you came out of the Q train. And we're getting there. There is now a big sign on Metropolitan saying a partner of New York Medical College since 1875. And when you come out of the Q train, you're looking right at it. We're not going to be able to get the one facing the FDR Drive on their building. We do have the banners now around WMC acknowledging our partnership, and Dr. Lebarsky is waiting to decide what the name is going to be of the WMC health system. After they do that, we have hopes we're going to get a sign on the roof of the building to be seen from the Sprainbrook. Dr. Schluger also mentioned the search for radiology. This is intellectually one of the more challenging searches I've been involved in because of AI. What's the future going to be of diagnostic radiology? About 3 weeks ago, the CEO of the Health and Hospitals Corporation of New York and Dr. Lebarsky were on a program where they were quoted in the newspapers as saying, we're prepared to replace diagnostic radiologists with AI, particularly for routine mammography readings. This got reported simply as a news story in some of the diagnostic radiology newsletters, but about a week ago, it got reported on Doximity, a physician's website, with a scathing attack from one of the diagnostic radiologists saying, there go hospital CEOs trying to save money at the expense of patient care using unproven technology which has not been clinically tested. This has not gone unnoticed by some of the applicants. So they want to come work at a place where such conversations are going on. We have 16 candidates so far for the diagnostic radiology search, some highly qualified, but what the future will be of diagnostic radiology in the era of AI is to be seen. We noticed a decrease, for example, in the number of NYMC students seeking to match in diagnostic radiology this year. When people start talking about whether there'll be jobs for diagnostic radiologists, people vote with their feet. I want to remind everyone of 2 upcoming programs. At 4:20 this afternoon in Skyline, we have a program being done at the request of the students on how medicine came to encounter AIDS in 1981, 82, 83. Some of us will be on a panel discussion talking what it was like to be a practicing clinician then. And then we're going to screen the movie from public television about how the American Psychiatric Association voted to remove homosexuality from the list of diseases from the DSM. It's an interesting film, and there'll be a group discussion afterwards. The field trip to the Cushing Museum at Yale is on Sunday. I believe it's a sellout, but there's a waiting list to go see the exhibit of Harvey Cushing's specimens, the so-called father of neurosurgery and neuroendocrinology. Commencement next month. We've got at least 2 to 3 dinners to organize. If anybody wants to have dinner with commencement speaker Mehta for the School of Health Science and Practice, the CEO of one of the divisions of Prime Health, let Rob Amler's office know. For the graduate school and the medical school, the commencement speaker is Sabine Hildenbrandt, who holds faculty appointments in anatomy and pediatrics at Harvard, is the co-chair of the Lancet Commission on Biomedical Education and the Holocaust, and is really the world's authority on the ethical disposition of human remains associated with Nazi atrocities, when often they're building a highway or excavating for a building in Austria or Germany, and they come across a large collection of human bones thought to be related to the Holocaust. Sabine is the expert on how to handle such situations. So if you want to have dinner with either of them, you'll email me, please, so we can figure out seating arrangements if you actually want to have a more detailed conversation with them, please. Okay, the floor is open for questions or comments. Please use the microphones because it looks like we have 115 people on Zoom, so we want to be sure that they hear the questions. So we're at your disposal. Can you explain the difference between a branch campus and an affiliated site? Thanks for the opportunity to ask questions. Given the rising inflation, living expenses, and consideration given to a cost of living adjustment for the coming year, to better reflect and support employees' financial well-being. Okay, we'll take them in order. A regional branch campus is an LCME accreditation term for a medical school located away from the mothership under the auspices of the mothership. There are about 165 MD programs in the United States. Of the 165, about 80 of them have regional branch campuses, meaning there's almost now an equal number of regional branch campuses as LCME accredited medical schools. Indiana University has 5 regional branch campuses. These were created originally typically at tax-supported public medical schools where somebody in the state legislature said, I want one of those medical schools in my district. And the flagship said, well, your district's pretty small, state senator, with medical schools here in the state capital. And the state senator said, did I all point out that I'm chair of the appropriations committee, doctor, in the state legislature? And so if you look at a lot of the states, you'll see these regional branch campuses that might have 20 or 15 students in which the voters were told if they go to school here, they're more likely to end up as interns and residents here, and they may end up in practice here. But it's not restricted by LCME rules to publicly supported medical schools. Any private school can do it too. So the proposal for Miami Beach is a regional branch campus of New York Medical College with approximately 50 students enrolled, in which in the first iteration, we will go for accreditation for M3, M4. And if that goes well for a few years, then go for accreditation for M1 to M4. And we've been looking at potential sites for an academic building there. For those of you who are not frequent visitors to Miami Beach, Mount Sinai Medical Center was established in 1948. You encounter it when you come across the Arthur Godfrey Causeway from Miami, and there is an enormous piece of property on the left on the Intercoastal Waterway. It's 41st, 42nd Street in Miami Beach. It's about a 450-bed teaching hospital with multiple residency programs, a very large cardiology program. And they have pretty much what we need with some exceptions. They don't have a pediatrics program. They don't have a big family medicine program. So we'd have to do affiliations with other health systems in Florida to have the full inventory of clerkships. They have their own research building, and the main biomedical science research going on there is related to pulmonary disease with an impressive flock of sheep. The research model are sheep, and they have a sheep OR and a sheep CT scanner. And I learned that the preferred gurney for an anesthetized sheep is a supermarket cart. It's how they get moved around the lab. So that's the plan. The second question about the COLA is the answer is yes, yes, yes. We're going to have to deal with the budget challenges that I laid out in my opening remarks, and we'll see what the budget can sustain for a cost of living increase, as we've done for the last couple of years. We typically are able to do them in January and February, but I I'd be a dishonest person if I made any promises about that. There's a lot of moving pieces as I've laid out about the budget for the COLA, but yes, it's certainly on the plans. Looks like another question has popped up. Thank you for the detailed information. Always appreciate it. Proud to be an employee. When will health insurance re-enrollment start and will our medical insurance costs increase? Tom, you want to take that, please?
Perfect timing on the question. We will shortly be announcing the annual open enrollment period, which this year will begin on May 18th through June 2nd for benefits that will be effective on July 1st. We will shortly be distributing updates on our plan options. We will be scheduling an on-campus health fair with representatives from our major vendors, including United Healthcare, tentatively May 19th, but I don't think that's been finalized yet, so don't necessarily write it down until someone tells me that Vilma said it was okay. We did shift some costs from what I would call fixed would have been built into the medical plans into a more variable component. You would incur it if you happen to use that particular service or expense. And we've been able to hold down the increases for this year. There will be increases in the employee contribution or biweekly rates. The data I looked at this morning put that in the 2 to 5% range. So much less than we have experienced in the past. Still an increase, much better than what we're seeing in the marketplace, but 2 to 5% looks like where we're winding up on the employee contribution rates. I'll be sending out much more detailed information on the plan design that will be in effect for next year, and including some new services that we're adding for virtual physical therapy, diabetes support, and other outreach for chronic care conditions. Thank you.
One of the costs we bear for health insurance is the amount of clinical business that we send to places that wouldn't give us the time of day for medical education. People who get health care at hospitals that will not accept our learners on clinical rotations and do not feed back into the system is a cost to us. Oh, let me offer my periodic advertisement. We have a family health center here on campus in Skyline. Camp physicals for your kids, preschool physicals because they're going to be on the high school football or baseball or basketball team. You need a blood pressure check. You need a vaccine. Dr. Solomon and her colleagues have appointments. You just walk over from campus, often same day appointments. To the extent that we keep our clinical business in the family, it's convenient, it's less expensive, and it helps our cost structure. It says, will UHC reward maximum also increase?
I believe that's referring to the UHC rewards program based on how many exercise milestones you reach, you receive a monetary award. That program is managed directly by UHC. I am not aware of an increase to the possible annual award that one can obtain. I will check that when I get back to the office. If we are finding that there will be an increase, I will make sure that's concluded in the documentation that we'll be sending out. And I encourage everyone to who utilizes our United Healthcare provided benefits to utilize the UHC rewards program. It is free money. Thank you.
There's a question on the chat box about an update for the School of Health Science and Practice Dean search. There were 4 candidates brought on campus for the final round, and then a 5th candidate emerged who was interviewed by Zoom. All the interviews are done. We should be at a decision on this search within about a week, so that an announcement can be made. That's the status of the search. If no more, it is 2 minutes of 1. We started on time, we finished on time. Thanks, everybody. Have a good afternoon.